Welcome to Women in Surgery Spotlight. My name is Katherine Sawyer, and I'm a second year medical student here at UAB School of Medicine. I'm also a member of the Association of Women Surgeon Student Chapter, and today we're highlighting the field of urology. So I'm very excited to be joined by doctors Tracey Wilson and Carmen Tong. Thank you both for being with us today. We're really excited. So to get started, I'd like to give you both the opportunity to introduce yourselves and tell us a little bit more about your day-to-day. So Dr. Wilson, if you'd like to start us off.
I am Dr. Tracey Wilson, as she mentioned, and I'm an associate professor here in the Department of Urology. I've been at UAB for 13 years now and have been the only woman in our department the entire time that I was here until just recently when Dr. Tong joined me. I spend my day to day practicing female public medicine and reconstructive surgery as well as neurourology. So I see a very specific population of patients, both men and women who have urinary dysfunction, and many of them have this dysfunction related to a neurologic cause. And I also treat female patients who do not have neurologic injuries, but have stress urinary incontinence, urge incontinence, or voiding difficulties for other reasons. I spend maybe a day in the operating room and maybe about 3.5 days clinical in clinic and a half a day of academic or administrative activities.
Hi, everyone. I'm Carmen Tong. I'm a pediatric urologist, and I just joined UAB this last August. So I'm a very new faculty member. I trained in Philadelphia at Einstein Medical Center, and then I did my fellowship in pediatric urology at Vanderbilt. Pediatric urology is my passion, so I spend all my time at Children's of Alabama. The main diseases or pathologies that I treat are hypospadias, spina bifida, vesicoureteral reflux, ureteral pelvic junction obstruction, just to name a few. I very much enjoy my work. I love treating children, and I am very excited to be here.
Thank you. Glad to have you both. Can you describe a little bit about your journey towards pursuing urology?
I did undergrad at Georgetown University and medical school at Howard University College of Medicine. While I was in medical school, I enjoyed renal physiology and was very much inspired by the director of that module, so to speak, at that time, and shadowed her and realized that, she was a hypertensive expert. And that was not something that I saw myself doing on a daily basis. And I just kind of wanted more. Then I went into the surgery clerkship, and I chose to do 2 weeks on urology because that was, just something that I chose, as many of you do, choose different surgical subspecialties. So I had chosen urology and orthopedics. And I absolutely hated orthopedics and loved urology and realized that I wanted to be a surgeon. And that was one field where I could merge my love for renal physiology along with a surgical subspecialty. So it seemed like a perfect fit. However, when I expressed my interest in urology to the chair of urology at the time, and this is very interesting because Howard University is a historically Black college or university. So I would have to say out of 85 students, out of 85 of my classmates, probably maybe 75 were Black. But that is the one institution where I was told I couldn't do what I wanted to do because of my gender. So he basically said to me, you can't do urology because you're a woman. And that just fueled the fire. And I found other resources to learn more about urology. There was a woman in DC who was a practicing urologist, so I spent time at her office, as well as just kind of circumvented him, and the rest is history.
For me, I took a slightly unconventional path, pretty similar to Dr. Wilson, actually. I started off my third-year rotations wanting to go into internal medicine. And very quickly on, during my medicine wards, I realized I did not enjoy very much of any of the internal medicine. And so I was recommended to consider a surgical subspecialty. I enjoyed the clinical portion of internal medicine. I just didn't enjoy the other aspects of it, let's put it that way. And so I looked into urology and ENT. Both, I think, have very similar aspects to the practice. But I really loved that there are a lot of different subspecialties to urology that you can pursue. And there's still a very strong clinical component to the practice. So you get to develop a lifelong relationship with your patient. So I ended up choosing urology. Also really helped that my surgical clerkship director was a urologist. And he felt that my personality would fit very much into the field of urology. And once I got to rotate with the urologists and found that their personalities were very similar to mine, I knew I found my home.
Have you ever had any challenges as a woman in urology? And if so, how did you overcome them?
I think once I decided that I wanted to do urology and matched, I was fortunate enough to match at the University of Connecticut. So there were two other women in residency with me. One was just a year ahead, and the other was my chief resident when I was a first year urology resident. Um, my biggest challenge, or I wouldn't say my biggest challenge, but my first challenge was um, I got married during the end of my surgical rotation or my surgical years, and my residency was 2 years of general surgery and 4 years of urology. So I got married in May of my PGY 2 year, and my chairman asked me if I was going to get pregnant such that I could time my pregnancy during my research year, which if I had done that, I would have gotten pregnant on my honeymoon. And that was not what my husband and I had planned. But he assumed I would do that because the female resident who was a year ahead of me did that. And that's worked out. That's what worked out for her and her husband. And it was a little bit challenging to me to hear him assume that I was going to do the same thing because that was going to be the least disruptive to our program. And I said, no, that's not what we really had planned. And I just kind of proceeded through the residency. And next thing I know, I decided to have my first child during my chief year, which, according to the program, was probably the least ideal. So that time was challenging. The good news is that I was able to take all of my call beforehand and work it out with my fellow residents. My daughter was born on her exact due date. So she followed the plan to suit. It was tough. I actually did 2 prostatectomies the day before I delivered. But fortunately, it was an uneventful delivery. And I came back after being off for 6 weeks. I was scheduled to be off for 4, but she was born at the middle of November. So I did get an additional 2 weeks because we were sort of around the holidays. And at that time, a lot of the chiefs, had earned the right to be off during the holidays. So it turned out that I was off for about 5.5 to 6 weeks, had a healthy baby, came back in, seamless into the residency and did not lose any time or lose any footing in regards to my timing of graduation and taking the boards or what have you. There have been other challenges throughout my career for various reasons, but I think that these are challenges that I can't necessarily say are necessarily related to my gender. There are so many women who are in surgical subspecialties and general surgery itself that we certainly have a good network and support system that I think that any challenging situation is conquerable.
Thank you. Additionally, what advice would you give female medical students when exploring surgical specialties?
The field of surgery is rapidly changing, and I think more and more programs see the value and worth and need of women in surgical subspecialties. I just looked up the statistic of female applicants to our urology match this past year, 2021. And I think it's something like over 140 applicants applied, and there was an overall 83% or something extremely high, match rate. And I think programs now see and understand the value of having women surgeons on the team, the different perspective that we offer, and the need to have women surgeons, taking care of other women patients. I can't tell you how many times I've heard a mother tell me, oh, thank goodness there's a female pediatric urologist on the team now, because my daughter was so afraid to see a male doctor. And that's partly why I chose to go into pediatric urology, because I wanted to take care of, young women and little girls who might not have access to a female pediatric urologist. And so I think female applicants need to know that you have a lot of power now. Women applicants are very sought after in many programs, if not all. And so realize that, don't be afraid. Don't let sort of previous stigma or rumors about a certain program scare you off. That sort of mentality and that behavior and thinking have really drastically changed even in the past 5 years, I think. And so don't be afraid. I think there are many women that are breaking the ceiling. There are many trailblazers like Dr. Wilson that are making, people like me able to go into urology and come to a program like here. And so, be bold, go for it. I know it sounds cheesy, but yeah, I think more and more programs are going to really try to, match women into their program. So it's really an exciting time, I think, for surgical subspecialties.
And if I could just add to what Dr. Tong said, I mean, the match rate for women in urology, as she mentioned, was the mid 80s, whereas the overall match rate for the entire 2020 class was 74%. So women matched at a much higher rate. And it's not because they were not deserving. Their applications were just as strong, if not stronger. But as she said, many programs recognize the value that we as women bring to the specialty. Women want to be seen by women. There are studies that show that they have greater outcomes, especially doing the things that we do, such as avoiding dysfunction. That's a very intimate conversation, and women oftentimes feel more comfortable having that conversation with a physician who is of similar gender. So yeah, I would again tell you to go for it. Don't be afraid. You all have great qualities that you can bring to any specialty, and don't let anyone tell you otherwise.
Thank you. And in closing, would you tell us about a hobby or interest that you like to do outside of work?
In my former life, I aspired to be a classical pianist. And so before med school, that was what my undergraduate degree was in. I was a piano performance major. And so that's my hobby now. It's no longer my job or my passion. It's still my passion, but medicine is my passion now. But outside of work, I play the piano. I think it keeps up my dexterity and works a different part of my brain, and gets me excited and thinking about something else other than medicine and work. And so that's what I do. I live in an apartment right now, so I have a little keyboard. It's a nice keyboard, but my goal is to eventually get a Steinway grand piano, and I play more formally. But that's what I do. Dr. Wilson, what do you do?
Okay, well, mine is not as impressive as your concert pianist. Although I did play the violin and actually picked it back up when I was in practice in Boston, and actually played with a group of doctors on the weekends. And but that was actually what prompted that was I was getting my daughter into playing the violin, and I thought that we could play together. Anyway, she ended up becoming a dancer, and I stopped playing the violin. So now my passion, and this changes, especially when you have children, and that tends to be your hobby outside of medicine. But my kids are now older, and so now I've gotten into essential oils. So that is my new passion. And just mixing and diffusing and finding different ways to use essential oils. And I find a lot of comfort in that and stress relief. So that is my new thing. It might change a year from now, but that's what it is right now and in today.
Thank y'all. I need to get some hobbies of myself now. But thank you both so much for taking the time to share with us a little bit about your journey throughout medicine and life in general. And hearing from both of you today has been really encouraging, definitely to pursue whatever goals you may have. So thank you both. We really appreciate it. And I'd like to also thank everyone that may be watching. And we hope that you really enjoyed this Women in Surgery Spotlight. Thank you.